2005. I thought this was a great opportunity when Debbie and Emily and Yamel put together this presentation for maximizing mobility in seniors, elderly who are isolated, right? I figured that's right in my wheelhouse. I am an expert when it comes to mobility, and we have a special program that we offer for those feeling lonely due to social isolation, which we know, as Scott spoke last week about the effects of loneliness, the physical manifestations on our body. It's like smoking 15 cigarettes a day and comorbidity similar to obesity. We're going to combine the two today and get into this presentation. If you have a question, as Emily mentioned, just hit the chat button and type it in, and hopefully somebody will interrupt me if I don't see it, and we'll address everything that we can. What I'm going to do now is I'm going to try to share screen. So bear with me for a second. I have a slide presentation I'm going to put up, and we'll go through the slides. I think there's like 7 or 8 slides, and then we'll have time for questions after the slides, or you could ask a question during it too. I don't know if I'll see it or not, but we're basically going to talk about what happens to your body when you're immobile, what happens to the body when you're mobile, some key points to try to maximize mobility. In the last few slides, I went over just a very basic plan that just about anybody could do no matter what environment you're in. So let me share screen here. Got it. Okay. All right. Is that up, Emily? Yes. Okay, cool. So what happens is I like to look at things at the most basic level whenever I'm trying to learn, analyze, whatever it may be, something. And the cells in our body, what keeps the cells in our body is fluid exchange, right? So when we talk about every part of our body is affected by our mobility status, it's true because every cell in our body needs fluid exchange. One of the best ways to improve fluid exchange is through mobility or exercise or activity, whatever you want to call it. So as we break down the cellular level, fluid exchange meaning fluid coming in and out of a cell, going into a cell, bringing nutrients, going out of the cell, taking out metabolic wastes, right? Pretty simple. What's the most important nutrient that our body demands is oxygen. There's many other proteins, vitamins, all kinds of other things that our body needs, but it can't do without oxygen. So as we bring oxygen to the cells in our body and other nutrients, we pick up the metabolic wastes, and that is basically recycled over and over and over 24/7 as long as we're living. So being that the better we have fluid exchange to our cells and tissues, the more healthy they are, barring some crazy physiological pathophysiology things that I'm not going to get into. This is a general discussion. But barring that, as we improve our mobility, increase our mobility, we're actually increasing the health of the cells in our body. So the first slide I'm going to put up is what happens to our body when we're immobile. So let's go over some of the effects of immobility. A lot of them you've heard. They're all up there. Let's go through them a little more detailed, right? So you get muscle weakness. As we become immobile, we stop utilizing our muscles the way that we would normally do, and they become weak. Our joints become tighter, we become inflexible, and even our bones require weight-bearing stresses on them. Our bones become less dense. So we think of weight-bearing stresses through our bones. You hear about osteoporosis and those postmenopausal women, which, by the way, anybody could get osteoporosis. It's just most prevalent in postmenopausal women. Our bones require not only calcium and the minerals that are stored in them to make them dense, they also require weight-bearing stresses. So weight-bearing, not only being upright with gravity, as gravity pulls down on our body, we have weight-bearing stresses, but also when muscles are contracted, every muscle has an insertion on a bone. And when those muscles are contracted, it creates weight-bearing stresses. So when you're immobile and you're not contracting your muscles as much as you normally would, you could have decreased bone density. The next bullet down is decreased circulation, cardiac output, and pulmonary function. I put those 3 together because they all work together. As our heart pumps, our lungs breathe air, and circulation fluid is circulated through our body. So as we're immobile, our pulmonary function goes down, our lung volume goes down, our cardiac output goes down, meaning the amount of blood that's pumped with each contraction of your heart, which in turn decreases circulation. There's also the risk of metabolic syndromes. That's big now. Like we're really, these metabolic diseases that are coming up, we're finding that they're very detrimental to not only our health, but our life. You know, it's when you go to apply and get health insurance, the health insurance companies are very good at predicting your health and about how long you're going to live. They use a very simple metrics. It's a few of the things you can control, a few of the things you can't control. You can't control your age or your gender, which they take into consideration, but they look at these four main metrics and they determine how long they think you're going to live, and that's how much you're going to pay for your life insurance. And they're your BMI, which is your body mass index. It's basically a ratio of how much you weigh according to your height, your blood pressure, which there are statistical norms for, your cholesterol, which there are also statistical norms, and your blood sugar. They take those four simple metrics and they predict how long you're going to live. So now we talk about, there's a lot of discussion in medicine now of metabolic syndromes, metabolic diseases, how it causes cancer, it causes heart attacks, causes strokes. And those are things, a lot what I just mentioned, blood pressure, cholesterol levels, if you have diabetes, weight management. So those are all controlled by healthy habits. Okay, and one of those healthy habits may be exercise and mobility. Also, obviously, your dietary habits play a huge role in it also. So down to the next one, effects of immobility. Did you know that being immobile can affect your urinary system? You could have urinary retention, meaning your bladder and your kidneys are holding more residual fluid than they normally would, which could increase your risk for urinary tract infection, which we know is very difficult to deal with in an age group as you age. Your blood-brain barrier level thins out, and the same bacteria that causes a urinary tract infection can actually cause delirium also. It can cause incontinence because your pelvic floor plays such a role in being able to control your bladder and being able to make it to the restroom. So we could have urinary incontinence as a result of immobility. It also affects your intestines, the motility of your intestines, basically the way you digest your food. It can speed that up or decrease it according to your activity level. And of course, the bottom one, where we're talking about isolation, is lowered mood, apathy, frustration, leading to possible depression, right? So let me just go into one thing really quick too, is the title of this presentation is Increasing Mobility in Isolation. So there's really two types of isolation, right? You can have social isolation or you can have physical isolation. Social isolation is more of a feeling. I could be in a room filled with people and still feel like I'm socially isolated. Yet if I'm in a room full of people, I'm not physically isolated. So a large percentage of people right now are physically isolated. I know that Palm Beach County is going through phase 1 opening, but there's still, if you're at a great risk for this virus, or you're in a senior residence where they're trying to protect everybody, you're still pretty isolated from a physical perspective. But that social part is what we discussed before. And it's funny how social isolation, one of the main treatments or one of the main ways of dispelling loneliness is through exercise and going outside, which exercise is going to increase your mobility. Let's go to the next slide. It kind of works hand in hand with this slide. So these are the effects of immobility. Now we're going to go to the benefits of physical activity and exercise. So I'm a certified health coach, and I get the certification every 2 years. And whenever we talk about trying to modify somebody's behavior, we always talk about exercise as one of the top things that comes up. If you sit down with the majority of people and say, what would you like to improve in your life? It's going to be either diet, exercise, or something that is a result of diet and exercise, such as losing weight. And what we try to do is we try to call exercise physical activity, because exercise for the average person has almost a negative connotation to it, right? Almost all of us have had a negative impact related to exercise. We've tried to do an exercise program and we just didn't sustain it. We failed. We tried to have an unrecognizable goal, an unrealistic goal when it comes to exercise, and we failed. So when you use the term exercise, some people are really shied away. Oh, you have to exercise 3 times a week. Like, I've been through that. I've tried that before. It doesn't work. So sometimes if you just change the term, the semantics of it, and just put physical activity, a lot of people are like, you know what? I think I can become a little more physically active. I'm not interested in exercising, but I could become more physically active. So your mobility is going to improve no matter how you look at physical activity, whether it's exercise or just an activity that you're doing. But let's look at the benefits of that. So the benefits of exercise, I'm going to go back to exercise, but you could use the term physical activity. Obviously, improve strength, muscle strength, endurance, and flexibility, right? The old saying is use it or lose it. It's very true with our body. When we put stresses on our body, that part of our body improves. It has to. So let me give you a quick story. I had a physical therapy clinic in Boynton Beach, and I used to be next door to this doctor who has since moved to Delray. And I was starting out. I was trying to build up my practice. I was getting referrals. I didn't think there were as many as I should get. I wanted to be busier, so I went next door and I talked to Dr. So-and-so, and I said, you know, as I watch patients come out of your office, I watch them stumble going up and down the curb. I watch them almost trip on the parking spots. And I watch some of them really have an issue getting from their car into your office. What do you think about referring some of those to physical therapy where we can improve their muscle, their strength, their endurance, their balance? And he says to me, he said, Joe, these people are like 85, 90 years old. They're not going to get improvement in strength and endurance. And I said, oh my gosh, I'm not going to, I don't want to argue with a potential referral source here. So I went home and I went on back. This is back in the early 2000s. There was a thing that you could log onto on the internet. I forget what it was, but it was basically access to all the journals of medicine and all those peer reviewed literature. And I printed out all these research projects that were shown. I had one that was everybody in the project was 90 years and up, and they did muscle strengthening with resistive exercises. And every single one of them not only showed increases in strength, but they showed increases in muscle mass too. Because we know as we age, we lose 10% muscle mass, lean tissue. After about the decade of your 20s or 30s, we lose about 10% per decade if we don't do something about it. Just it has something, our hormonal levels get down, our activity goes down, and we lose lean tissue. So I brought them all this literature and said, hey, listen, we shouldn't exclude somebody that's 85 or 90 years old from physical therapy because everybody could increase their strength. Everybody could increase their muscle mass. And of course, remember, I'm talking generally. There are some neurophysiological diseases that you get that they cannot. But for the most part, most people can increase their muscle strength. And how do you do it? You do it through resistive exercise. How do you increase your endurance? You do something over and over again, a little bit more each time, and you increase your endurance. Endurance is your ability to contract a muscle over time. Strength is your ability to contract a muscle once. Flexibility is the range that your muscle can lengthen and contract. Those all improve with exercise. We have improved cardiac, pulmonary, and circulatory functioning. We kind of hit on that, right? On the previous slide. So if I stress out, if I do an exercise, right, we know that the best exercises to do for cardiac functioning are the largest muscle groups in our body, basically our quadriceps and buttocks. If we use those muscles with resistance, it improves our cardiac system because our heart has to now pump harder, to get more oxygen to the area. Remember, we talked about fluid exchange. There's no greater way to increase circulation to an area than to exercise that area, because as we contract a muscle, it needs more oxygen. As it needs more oxygen, our heart pumps faster. As our heart pumps faster, our breathing rate goes up. We actually start breathing more. We might get a little shortness of breath, but as we do that, as we stress that system, our lungs increase the volume in which they could process oxygen. Our heart at rest becomes more relaxed. Our circulatory functioning becomes better. Remember, these are all muscles. We have skeletal muscle, which is what we're basically talking about strengthening, but we have our heart is a muscle, it's cardiac muscle. Our veins and arteries are muscle, they're smooth muscle. So we're improving all those systems with physical activity and exercise. Improve bone health, right? For the opposite reasons that we talked about in the previous slide. That when we are more active, we have the weight-bearing stresses that occur through our bones to increase bone density. Weight management. How is weight managed through exercise? Well, it burns calories, number one. So the more calories you burn, the less you're going to store the energy that you've eaten, which is basically gets stored as fat. The less you're going to store. You're going to manage your weight because you're using it more efficiently. Your blood serum levels of glucose go up really high after you eat. Your body can't process all of that. But if you just go for a 10 or 15-minute walk after you eat, your muscles are going to use up some of that oxygen, so you're going to have weight management. You're going to have relief from physical pains, right? There's a lot to this. There's not just from your musculoskeletal perspective. Let's say I have hip pain and I start a gentle walking program. And as I walk, I get into 5-10 minutes, I start to loosen up a little bit. I'm like, oh my God, my hip pain is going away a little bit. It's because everything becomes looser, the muscles become stretched, there's more blood flow going to the area, there's more fluid exchange. Now, that also can be the opposite. Some people that have terrible arthritic process in their hip, if they walk beyond a certain period, they start to get more pain in their hip. So then we have to adjust the program that we're doing. It's called pacing, where we build up levels. But there's also a reason why pain is reduced with physical activity and exercise, is because the area in your brain that processes pain, it's called your homunculus. It's the middle of your brain. There's a representation of every body part in it. And typically in the person that doesn't have chronic pain, your hands, feet, genitals, and mouth have the highest representation because those are what's most important for survival. As we develop chronic pain, if you ever notice something, by the way, if you cut your hand or your mouth and cut your arm or your leg at the same time, your hand and your mouth heal much quicker than other areas of your body. It's the same principle. We need our hands, feet, mouth, and genitals for survival. And that's why the pain, you actually typically feel pain worse in those areas. So what happens is that homuncular representation in our brain can be altered, okay? It can be altered depending on a pain. Like if I have chronic pain, let's say I did cut my hand, and that pain is typically for 2 or 3 days as it starts to heal. But if I develop chronic pain in my hand, my pain is just an alarm system. My alarm system is going off for nothing, right? And the area in my brain where I have pain starts to get larger. So the representation in the homunculus gets larger. So when you actually increase your activity and your exercise, it's actually one of the ways of getting rid of chronic pain and showing that area of your brain, you don't have to set that alarm off anymore. You don't need to give me pain. What it does is it shows I can move that body part normally now. Look, my knee is moving. I'm not doing any more damage to tissues. And a lot of times it will actually reduce the pain that you have. So it's important. It's an important concept that physical activity and exercise is actually good for pains. For those of us who are old enough, or those of us who have researched back pain, back in the 60s, early 70s, when somebody had back pain, they would literally get an order from a physician to go on bed rest. And now that we know through all kinds of research that that's like actually the worst thing for back pain is bed rest. And you know who started that all? That all got started with a doctor by the name of Janet Travell, who other MDs in the area thought she was a quack because she did trigger point therapy. And she was actually John F. Kennedy's doctor, and John F. Kennedy had a lot of back pain. Being the president, a young president of the United States, he couldn't be put on bed rest, sorry. So Janet Travell came in and did a prescription she did trigger points to help ease some of his muscular pain and prescribed activities. And that's when we began to realize that, movement is better for your spine than bed rest. So then we have some of the other benefits are mental health and energy boost. Exercise, activity, it's just good for your well-being. It feels good. the more you do, the more motivated you are to do. There's all kinds of feel-good chemicals that get released in our body when we exercise. They're called endorphins. Basically the opposite of cortisol. When we're in a stressed out situation, our body produces cortisol, which actually impedes tissue healing. But when we exercise, all these endorphins get released to the point where like no other activity that we perform, with the exception of with restful sleep, a lot of those good chemicals are released also. So we get an energy boost, and we have much better mental clarity, better mood. There's studies out there that show aerobic exercise actually decreases our risk for Alzheimer's disease and brain cell breakdown. That's because you're increasing circulation in your brain also when you exercise. So next one being better sleep and stress release. We just touched on that a little bit. And one of my favorite benefits of exercise is protection against health conditions. It lowers your resting heart rate. Exercise lowers your blood pressure, lowers your blood sugar levels, lowers your triglycerides, your cholesterol, and really helps your cells live in a better, healthy lifestyle. All right, let's move on. Am I moving too fast? Emily, give me a thumbs up or down if I'm going too fast.
You're good.
Okay, because if we have questions, just interrupt me. I love this picture. I saw this picture.
No questions yet.
Okay, good. We'll have plenty of time when I'm done. So I love this question, this picture. This shows a guy who's definitely physically active and enjoying himself. He's got the old hula hoop out there. And I look at this guy as a physical therapist. So I'm looking at his shoulders, his hips, his knees. He's got pretty good range of motion, must have pretty good strength, and he is enjoying himself outdoors. So that's a great picture right there. So what are some of the keys? So we talked about the effects of immobility, the benefits of exercise and activity. Knowledge is power. The more that people know what is going on with their body, the more they can take charge, right? So some of the key points. Well, we know physical activity can reduce frailty, right? So we talked about those 4 main metrics that a life insurance company will evaluate before they give you a policy. Now we're starting to evaluate seniors on a frailty index, right? So frailty means loss of appetite, loss of weight, loss of height, weight, appetite, loss of muscle mass, loss of balance, loss of some of the things that allow you to live with a quality of life, high quality of life. So these frailty indexes are predicting people's quality of life. And what happens is when you become frail, the more you are at risk for falls. And we know that falls are the leading cause of trauma in those over the age of 65. So we want to reduce falls at all costs. That's a whole nother lecture, but falls, especially if you work in a facility or you are working with seniors, falls being the leading cause of trauma for those. After one suffers a fall, they have over 50% chance of having another fall within 9 months. So it's very important for those that fall that we address the falls. 1/3 of falls are due to environmental factors. 2/3 of fall are due to some type of issue that got in the way of their balance. So the 1/3, I always tell people the 1/3 is easy to take care of, because those are things such as wet surfaces or electrical cords in the way, or a pet that gets in your way and you trip and fall, or those parking spots out in the parking lot, environmental factors, throw rugs that may trip, the type of shoes you wear. Those are preventable issues that can be taking place. But when you become frail and you have weakness, which your weakness affects your balance, you want to intervene and do things that strengthen your muscles and improve your balance. The next one says, literature may also indicate strengthening and balancing exercises are the most appropriate for this age population, right? So if you go to a gym and you see a bunch of 20 and 30-year-old people working out, it may look a little different than somebody in their 70s and 80s. For many different factors. We change, our goals change as we age, our bodies change. And what's been shown to be most effective is a strengthening and balance program for those in the senior population. The next one says performing exercise with a social element may improve adherence and motivation. Makes sense, right? We're social creatures. People are social. We want to be around other people. And As we go back to the whole loneliness aspect, those who feel loneliness, which by the way, loneliness is a normal emotion. It's just when it persists beyond 48 hours, it becomes an emotion that is not normal. And what happens is it creates like this cycle. And even more so than a cycle, it's almost like a snowball. The more lonely we get, the less we want to be involved, and the less we want to go to social outings or do exercise or anything like that. So it's like this perpetual thing that goes on because we're social creatures. And if loneliness goes on too long, it could actually lead to depression, right? So before we get to that stage of loneliness, we're very social creatures. So performing exercise socially, it's not only adherence, it's motivation. When you do something with somebody else, you kind of have like this little sense of accountability. If I have an appointment with myself and I say, you know what, I'm going to work out at 3 o'clock this afternoon. I'm going to do push-ups or whatever I feel like doing around. 3 o'clock comes and I say, you know what, I'm going to wait till tomorrow and do it. Well, if I had an appointment, like let's say with my son who's home from college right now because he's doing online classes, and I had an appointment with him and he says, no, come on, we're supposed to work out at 3. Let's work out at 3. I'm held a little more accountable, and now my motivation goes up to do the exercise. So there's a definite social element, and we'll get to the next one with technology. But the more we can do socially, the more we'll have success doing an exercise program. Yes?
Oh, sorry.
Okay.
Before you're moving on to the video games and technology, John has a question. How do you weigh the risks of falling when encouraging mobility?
That's a great question, right? So I have a slide coming up on balance. So what happens is, this is my little joke. This is my little inside joke. I tell people, when you're in physical therapy with me and I give you a home exercise program, I say you're not allowed to fall, which is kind of a joke, right? So there's a fine line between giving somebody something to do. You know, when I'm with them and I'm doing physical therapy with them, I have a gait belt on them. You know, I'm trained to, if somebody's, you know, going to lose their balance, I'm trained to put the, you know, get their center of gravity back over their base of support to get them to regain their balance. If they are going to fall and I can't hold them up, you know, how they're going to fall, how you're going to protect their hips and their head and their shoulders as they do fall. So when that's not, you know, that's not now, that's a perfect environment. When we're not in a perfect environment, what I usually do is I tell people, and we'll discuss this in a second too, is I tell people you have to do what's comfortable at first. So when it comes to balance, the only way of improving your balance is by challenging it. And how do you challenge your balance without creating a risk for falls? Well, what I usually do is I have them stand maybe in front of the kitchen sink. We got that little row of counter right there. It's very stable. It's more stable than a chair. It's more stable than a towel rack or something on a piece of furniture, whatever it may be. If I fall and I grab onto that counter, I shouldn't say fall, if I lose my balance and grab onto that counter, is not moving. It's going to hold me up. So I typically start with a very basic balance exercise program where I can hold on. Right? Now my balance isn't going to improve dramatically if I'm holding on, because I can't hold on when I'm walking across a parking lot. So what you do is you gradually let go while you're doing some of these exercises, or you gradually increase the challenge that you're doing as you see the balance improving. Because the last thing you want to do is give somebody an activity to improve their balance and then get a phone call that so-and-so's in the hospital with a fractured hip, right? So if I didn't answer that question well enough, when I'm done with the balance slide, let's go back to it, because I love balance. Is that okay? I'm not sure who you said asked. Okay. So, so going back to the social element of motivation and adherence to a exercise program, technology plays a role too, because now we know that technology can be used for social elements. I mean, you could literally do what we're doing right now and be exercising with somebody. You could there's all kinds of games that interact socially. Like, you know, these younger kids, they play games and they're on their phone playing a game, and it's actually against somebody else that might be on the other side of the world. So technology, and then of course you have the incredible video games, that a lot of the video games now are not just targeting kids and young adults. They're also targeting those as we age. There's so many cool aerobics and Zumba and strengthening and all kinds of games. And now they're making exercise equipment. You know, they have that bike, that Peloton bike. What's the name of the company? I forget the name of the company that has the rowing machine and everything. And now they actually have a screen built onto them, and you log in and you do a workout with a group of other people, and there's a trainer that's leading the way and everything. So technology's come a long way, and it is a solution. It's not a solution for everybody. You know, there are certain hearing, visual deficits you may have, or might not be interested in technology. You might know technology about as well as I do, or I can't even turn that stuff on without needing help. But there is a role for it to play, and you'd be shocked. My wife has a aunt who, I think she's like 86. She's in her mid 80s, and she's on Facebook nonstop. She does all these. She has to show me how to do a post on Facebook if I want to do a post on Facebook. So a lot of people discredit people in that age group as not being technology savvy, but some of them really are, and technology could play a role in this. So the last two down on the bottom. So when we're trying to maximize mobility in isolated seniors, what you want to do is you want to set personal goals, right? And when I say they have to be individual, it's because, you know, like my goal is going to be different from Emily's, which might be different from Yamel's, which might be different from Debbie's. So it doesn't make any sense for, you know, if somebody's training for a marathon and that's their goal, I know I'm never going to run a marathon. I know I would never want to run a marathon. I know I could never do it, even if I wanted to. So, you know, we have different goals. You know, my goal might be to decrease my resting heart rate by 10 beats or something of that nature. So you want to be able to establish personal goals. So I know that the audience that's listening right now may be doing this because they're at a facility where there's a lot of seniors who are isolated right now. Or some might be doing this because they want to learn more about their aging parent, whoever it may be. But no matter what, when you set personal goals, it's individualized. And what works really best from a behavioral modification perspective is if the person makes their own goal. And so what I usually do is I ask them, I say, what are the three main things you want to accomplish with your increased physical activity? I don't use the word exercise unless they bring it up. So through your physical activity, give me three main things that you want to change. And I just have them write down those three things. And after they write down those three things, I say, just do me a favor, circle the most important one. We'll get to the other two later. Let's do the most important one right now. Because, you know, it's hard enough to do one thing, let alone three things. So they'll circle the one thing, and then I'll ask them, okay, so you want to be able, you know, you want to start walking more. How much more do you want to start walking? What do you think you can do? Well, I think I could walk for 10 minutes every morning. Let's make that a goal. 10 minutes every morning you're going to walk. And then when you're done, a week goes by, you reassess it. How did you do? How did 10 minutes? You know what? I didn't walk 10 minutes a day. I've been walking 20 minutes. You know, I missed Tuesday, but every other day I walk 20 minutes. And you take it from there, because when the person comes back to you, whoever they're held accountable to, and they say, no, I just didn't do it. They made the goal. They can't say, you know, it was too much. You know, you had me doing too much. You know, I'm doing 3 sets of 10 of this and 5 minutes of that and 10 minutes of that, and it was just too much. I couldn't do it. So they set their own goal. Now you can ask them, say, well, what do you think we could do for you to reach your goal? And it's all letting them set their own goals, and you'll see how successful they become if they're really motivated to do it. It's actually incredible. It's called motivational learning and motivational interviewing, in that they're setting their own goals because you really don't know what their goals are. And as you tackle the first one, you incorporate the second one, and then you can incorporate the third one. And they're well on their way to a program that's increasing their activity. The last bullet I have down there is get creative at each program, or get creative as each program can be different. So let's talk about somebody who's in, let's say somebody's in an assisted living facility right now, and they're still physically isolated, a lot of them, because there's a real threat. You know, like if you watch the news, it's like scary to see some of these facilities up in Massachusetts and New York, and how everything spreads so rampantly through there. And the ACA in the state of Florida is mandating all these changes that have to occur in facilities, you know, assisted living facilities and nursing facilities. So some of those people are in their room, they don't have access to go to the gym and walk on the treadmill. They don't have dumbbells. They don't have this. They don't have that. So sometimes you have to get a little creative, and you have to do exercises that mimic functional movements. The resistance can be like an exercise band, or they might not even have that. They can grab a can of soup, grab a purse and put some weights in it. So you get creative in what people have available to them. And actually you'll find that the more creative you get, the more individualized and specialized the program is, the more the adherence is to it. The statistics of long-term use of gyms is ridiculously low. You know, there's a reason why gyms love January 1st. They get all these members that join because of their New Year's resolution. They sign up. By the first week of February, the majority of those people will not see the inside of the gym again for the year. And the gyms are hoping that the monthly fee keeps getting paid. So gyms do not have a high success rate with use and retention. But as you get creative and specialized and you show somebody, oh my God, you can do this on your own, not on your own, the adherence to the program is a lot greater. All right, I'm gonna go to the next slide. So how much exercise is best? This is the most recent stuff. Yeah, they're determining that 150 minutes of physical activity is what should be, that should be normal for somebody in a week. Now, remember, it's physical activity. This does not have to be going to a gym or doing 3 sets of 10 of this or jumping on a Stairmaster or whatever it may be. It could be, you can count vacuuming the floor, walking up and down stairs, but it's 150 cumulative minutes of physical activity is required to maintain a healthy body. That's including all those things that we talked about, the effects of immobility. Those effects of immobility start setting in when we have less than 150 minutes per week of physical activity, right? So I talked about some extreme examples. Imagine if you're on bed rest. I mean, we know with bed rest, your pulmonary and cardiac function starts to reduce after 24 hours of bed rest. So, but what about just slight changes in our health, right? Because really, you know what? I'm only active. My son came home for in between semesters around the holidays, and he introduced my wife and I to that app on the phone, that health app that comes with the iPhone where it tracks your steps per day. I didn't even know that the phone came with it. So I set a goal of walking 10,000 steps a day. And I've actually done it almost every day since like mid-January. But when I look at my stats from last year, there were days that I had like 1,200 steps, which is so sedentary. I mean, it is so ridiculously sedentary. It's almost like shameful for somebody to claim that they're in decent shape and they've walked 1,200 steps for the day. I mean, I could practically go get the mail and walk to my car a couple times and get 1,200 steps in. So you want to have 150 minutes per week. But what happens is, let's say I only have 60 minutes per week. So all those effects of immobility, I'm not all of a sudden, you know, my VO2 max and my resting heart rate, my blood sugar and my cholesterol, it's not all of a sudden just going to skyrocket. But over the course of years of being decreased activity, those things start to manifest themselves. And now I do have a cholesterol problem. And now I do have cholesterol building up on the plaques on my arteries. And now I have all this stuff occurring to me, to my body. So 150 minutes that's our target. More is even better. And then we want to do strengthening exercises 3 times per week. And they say 20 to 45 minutes. Strengthening exercises, exercises are kind of like, everybody wants to know the fountain of youth. You know, and is there supplements we can take? Is there certain foods we can eat? And yes, there are certain foods we can eat that make us much healthier. But man, mobility is the fountain of youth. I think we're going to get into exercises now. Okay, so let's go back to that question too. So we're going to go through the balance exercises, right? So I tried to do them from the easiest to the most difficult at the top. So I might start with somebody, if somebody's really at risk for falling and I'm giving them something to do at home, I might start with just weight shifts. Now, the picture that I put up there, I could only find it in front of a chair. I couldn't find the guy doing it in front of a countertop, but I would prefer to do it in front of the countertop. Most people have a sink with that little row of counter right there. And what I tell people to do, I don't know if you can see my hands, I say, so I grab onto the countertop, right? And as I'm getting ready to start the exercise, I ask them, just relax your hands and lift about an inch up. So I'm not actually holding onto the countertop, but if I do lose my balance, I tell them immediately grab on and restart the exercise. Don't have all that stuff where you got your balance, you're trying to gain it. None of that stuff. The second you lose your balance, grab on, start over. So simple weight shift, right? So weight shift, if I'm standing on both feet and I shift my weight from left to right, left to right, I could also do it shifting my weight forward and backward. These are all normal movements that occur in everyday activity when I'm walking around. I have to weight shift, I have pelvic rotation, and I shift my weight every time I walk. And some people lose their balance when they shift their weight. Some people lose their balance when they're walking and there's a change in direction, you know? So you do that, and as the person gets good at that, now you could do it with your eyes closed. So when you take it, your balance, there are some main factors that play a role in your balance, right? One of them is strength. If your quadriceps and gluteal muscles aren't strong enough to hold you upright, you can't possibly have good balance. There's actually studies that show a correlation between muscle weakness and higher risk for falls. So the first thing I can do to improve my balance is strengthen the muscles that hold me up. But another one is called proprioception. And that's your body's awareness of where it is in space. It's really affects our balance. It's kind of like if everybody tries to touch their nose, you can touch your nose. You don't have to look at your finger and your nose. You just touch your nose. It's because your body knows where your finger is and your nose is. That's called proprioception. Well, those proprioceptors, the area in our body where we have the majority of them is the bottom of our feet and our neck to determine head movements, and the bottom of our feet for when we're walking. The typical person with normal proprioception does not have to look at the ground when they walk. They know when their foot's going to hit the ground, right? Now we tell them when obstacles come, we're scanning our environment constantly visually, and when we come upon an obstacle or a change in elevation or something, of course we want to look down at it, but typically we're not looking down at the ground. That's why sometimes there's like an optical illusion. You're getting off an escalator, at a department store, or there's a weird pattern carpet or something, and it throws off our perception and we kind of stumble a little bit because it threw off our proprioception a little bit, or our visual field did. So now the reason why I say weight shift up here to progress to eyes closed is now we remove our visual field, which provides incredible input to our balance system with depth perception. We remove that and we're completely relying on our proprioception. Those sensors on the bottom of our feet. Through inactivity, they don't work as well. So we want to challenge them. And remember, the more we challenge them, the better they get. So just simple weight shifting, whoever asked that question, just simple weight shifting back and forth, having something that could really support them if they lose their balance. As you get better at that, try it with your eyes closed, hands still right above the supporting structure that's going to hold them up. Another simple one is head rotation, right? If I move my head back and forth, I'm stimulating my vestibular system, which plays a role in my balance also. I could start doing that statically, literally sitting right here. I could move my head back and forth. I'm stimulating my vestibular system when I do that. Then I could do it standing without moving. I might have to hold on at first. You'd be shocked if everybody were to stand up right now, don't hold on to anything, and immediately take their head and turn it. Raise it up as fast as they can. And alter your vestibular system, the input going to your brain. Some people lose their balance doing that because our vestibular system is a series of, our middle and outer ear we hear from. Our inner ear is our vestibular system, and we have 3 canals in there. And in those canals are fluid, and there's hair-like nerve endings that send feedback constantly to the cerebellum of our brain about how we're moving around. So when that gets altered, it can create a little dizziness and you can lose your balance. So this head rotation is something that stimulates your vestibular system. You could get to a point doing this. You could start sitting, move to standing with arm support, move to without arm support, and then move to walking. It's very challenging to do this when you're walking back and forth with your head moving. Now you wouldn't do that until you mastered the other ones, because we don't want to have somebody falling practicing their balance. The third one down there is a tandem stance. This is progressing to tandem walking. Some people call this heel to toe. I don't like to call it heel to toe because actually heel to toe means the way that we're striking our foot when we're walking. We're going from our heel to toe. but this is called tandem stance. It's literally standing with no base of support. Right, when we're normally standing, the area between our feet is our base of support. We know the more we increase our base of support, the more stable we are. Well, this is actually eliminating our base of support, putting our feet, our heel to our toe, and standing kind of like if there was a line on the ground or on the grout of your tile or something, standing there. Once again, we can start doing this in front of a sink or you know, if they have in between a walker or something, and letting go and increasing that time that you can stand statically without moving. And then you can progress to walking, kind of like if there was a line on the ground, walking on that line, right? What that does is that challenges our stepping strategy. When we lose our balance, we have three main reactions. Our body has three main reactions. We have ankle sway, hip strategy, where we lower our center of gravity. And the third one, most important one, you could avoid a fall with it, is a stepping strategy. So we'll typically, if you're walking on a line and you lose your balance, you'll typically step out in the direction you're losing your balance. And the reason for doing that is to get your base of support back underneath your center of gravity. And it really trains that. That's a reaction. Most people don't have to think about it. If everybody watching this goes out and tries this, it's a reaction. But for somebody who's been immobile and they kind of lose a little bit of that reaction, it has to be retrained. So this one, you don't want to give somebody to do this first thing. You want them to start building up to this. And that last one down there, unilateral stance, that is my favorite one. That is my favorite activity. I've had physical therapists argue with me that it's not their favorite activity, but that is my favorite activity for improving balance. There are statistical norms for age. They're age related. If you're over the age of, it only goes up to 69. If you're over 69, you should be able to stand on one leg for 12 seconds, or you're at a higher risk for falls. If you're up to the age of 39, you should be able to do it for 30 seconds. It is an incredible, I used to have people that would come into my clinic that could not do that for a split second, and they go home and they practice it in front of the kitchen sink. You can't be holding on, but you can be ready to hold on. And they've practiced that. They'll come back, they could do it for 5 seconds, 10 seconds. Before you know it, I'll have somebody 85 years old doing it for a minute. And it's so important, because if you think about it, every time you take a step, you're standing on one leg. The second I step with my right leg, I need to balance on my left leg. And a lot of people lose their balance when they're walking. And this trains everything. I mean, if you were to try this right now and stand on one leg, you'll feel all the muscles firing down by your ankles, trying to hold you stable. You'll feel your body moving, your vestibular system and your depth perception and proprioception. It's all combining. So I love this. You could combine everything doing this. So now the person, your parent or your resident or whoever you're doing this for, they get all, and they're like, oh yeah, that's a piece of cake. I could do that for a minute now. Oh, okay. Now do it and turn your head back and forth. And let's get your vestibular system involved. Or now do it and let's do a little squat where we reach down and do almost like a little bit of a deadlift and come up and strengthen the glutes. And there's just so much you can do with unilateral stance. And you can even just do something simple and close your eyes. It's like 1,000 times harder with your eyes closed, and that you have to be doing that where you can grab onto something. Okay, the next one I have is strengthening exercise. How are we doing with time? Funny thing is, you know, when I made this presentation, I was afraid that we were going to blow through it in like 10 minutes and I wasn't going to have much to talk about. But I do want to save some time for questions too, if there's any questions or comments. So strengthening exercises, I just did a couple really, I'm going to call them basic lower extremity exercises, but man, squats and lunges, they'll get every muscle group in your lower half, you know, and squats, we can call them sit to stands. You don't have to sit there and put a bar across your shoulders and squat down with 200 pounds. This could be something like in those goals that we were talking about setting. If somebody wants to get better at getting off the couch or out of a chair, we could set a goal of doing 2 reps, you know, twice a day. In the morning, they're going to get up from a chair with their, you know, with their arms out like that and everything, twice, and in the afternoon twice. And before you know it, they're doing 3 sets of 10, holding a jug of milk as resistance. So it's a very, very functional movement. It requires a lot of power in our quadriceps and our gluteal muscles. It requires a lot of biomechanical features. You know, you have to get your center of gravity forward. You can't be sitting, you can't lean back in the chair and stand. Nobody can do it. If you're leaning back in your chair, you cannot stand up. So it requires a little biomechanical processing of your body, and it requires a lot of power and strength to get up. It's a great exercise for improving function. And then you have lunges down there. The reason why I put two pictures is because one of them is a forward lunge. And let's say the person isn't strong enough to do a full lunge. You could actually use your arms, like she has her arms. You could actually use your arms and get a little upper extremity support to push back when you're doing the lunge, right? That's a forward lunge. You could do these backwards, to the side. And, you know, our functional patterns, when we move throughout the day, we move in diagonal patterns. We don't move in a linear fashion. Very rarely do we just go in one direction. And, you know, like if I'm reaching up into the cabinet or the refrigerator, I'm crossing my body, I'm reaching over, I'm putting it over on the counter. I'm, you know, if I walk, very rarely do I walk in a straight line. So lunges I love because you can change the angle that you do them, and you could do them sideways, you could do them forward, backwards, and it becomes a very functional movement. It's incredible for your balance and your strength. So that's lower extremity. Upper extremity, overhead press, you could use just about anything that has a little bit of weight to it. You could use just your arms at first, right? So if I use my arms, I'm going to work on range of motion on my shoulders. A lot of times, just due to gravity, the older we get, is you start to have postural changes. And it's just because of the effects of gravity throughout our life, just pulling down. Whatever we did for work might have been unilateral, one-sided, so it's pulling down one side more than the other. And what happens with our shoulders is as we get a little rounded, if our shoulders get a little rounded, our spine becomes kyphotic, our head gets forward, it incredibly reduces your shoulder range of motion. So look, everybody, lift your arms above your head. Can everybody lift their arms above their head? You see how you can do that normally? Okay, now, slump in your chair, slump over, put your head forward, and try to lift your arms above your head. I mean, it changes the whole body mechanic, the biomechanics of your shoulders. So the overhead press is a great exercise. Sit up straight, chest out, and do it. It's a great range of motion exercise, but now we're going to add some resistance. And if there's no dumbbells in the home, no problem. You could grab anything. You can grab, my wife has some candles around here. You can grab a can of soup. You can grab anything. And you can start with a little resistance and you work your way up. Your shoulders are getting stronger. Your scapular muscles are getting stronger. Your posture's getting better. So that's overhead press. You have a wall push-up. Wall push-ups are great, not only for your triceps and chest, but they're also great for your scapular stabilizing muscles, which are really important for, your scapular muscles to keep your upper spine nice and tight when you want to stand up straight and get your chest out. If you notice this guy, I'm over here pointing at my screen thinking you guys know what I'm pointing at. But see the guy in the set where he's actually going into the wall press. I would like to see him with a little less arching in his spine, because if he were to contract his abdominal muscles, he would really activate his core, and this would be a core exercise also. He's getting a stretch in on his calves and his hamstrings. This is a great functional exercise too for somebody that's not like a gym rat that wants to go bench press and do a bunch of push-ups and everything. Push-up is fantastic for upper extremity strength. And then I put a little something in for arm curls, right? Arm strength is so important just for simple things, as I mentioned earlier, getting a jug of milk out of the refrigerator. So you want to do arm curls with some type of resistance. It can be your purse. It can be anything that weighs from 1 to 10 pounds, you know, and you could step your way up to it. And then I have one more slide on combo exercises. I love combo exercises. Combo exercises are totally functional. They're functional movements, and they combine not just strengthening, but they combine flexibility, endurance, all kinds of stuff. So the first one up there is sit to stand combined with an overhead press. So imagine that lady in the previous two slides getting up out of the chair. Imagine if she had a couple cans of soup in her hand. And as she's getting up out of the chair, she's going up into a shoulder press also. It activates practically every muscle in your body. I mean, it activates your core, your lower half, your upper half. It's super, super exercise. You got marching in place, because we do have to hit endurance. We talked a lot about strengthening. But endurance, as I mentioned earlier, endurance is your ability to contract muscles over time. They play a huge role. You know, if I'm sitting in my dining room, which I am, and my bathroom is 25 feet away, but my legs are only strong enough to hold me about 15 feet, which is endurance, right? That last 10 feet, I'm at a huge risk for falls. Or forget about it. That's a very immobile person. But how about if I want to go to the mall and I want to walk around the mall, and I can walk for 20 minutes, but now I'm beyond the 20 minutes and there's not a chair in sight, I have to sit or I'm at a huge risk for falls. So I want to increase endurance. Marching in place is a great way to increase endurance. And the reason why I put those two pictures up is some people aren't ready to do standing marching in place. You can start in a chair. You know, your pelvis is supported. You don't have to worry about falling. You don't have to worry about losing your balance. You can go through the activities with your arms and legs. You could graduate up to holding on in front of a sink. This one's a little harder in front of a sink because sometimes your knees hit the cabinets. And you can go to a chair, behind a chair, because it's typically you're a little more stable doing this exercise. And you work your way up to like the woman on the left, and you do it without holding on with upper extremity support. There are also statistical norm for the 2-minute test. The 2-minute step test is you should be able to do, I think it's around 70 steps. You choose which side, either your right side or your left side. So it's basically doing 140 steps within 2 minutes. I'll get people that I test doing this on their first time evaluation. They can't even do it for 2 minutes. Forget about, they don't even complete it. A lot of people do about 30, we count the right leg on our evaluations. A lot of people do 30 steps and they're done. But this, like everything else, this you could really show objective improvement. I mean, people love it when they improve at something. And you could show, hey, listen, you did 30 steps today, right? Last week you were only doing 10 steps or whatever. You know, you're doing 3 minutes today. Last week you're only doing 2 minutes. And it's very motivational to see yourself improving. That's why one of the things I was really supposed to talk about when we were talking about goals is set like objective, attainable goals. They have to be objective, meaning that they have to be seen. It has to be something that can be objectively written down, or it can be the same for me, and Emily could look at it and she could see the same thing. It can't be something like, you know, that was good or that was bad, or write down exactly what it is and make it attainable. You don't want to set a goal that you can't attain. I mentioned the marathon. You know, I could never run a marathon. I used to jog 3 miles a day when I was in my late 20s, early 30s. I couldn't even do that now. I'm not going to make a goal of running a marathon. And then the last one I have is the farmer's carry. The farmer's carry is also a great exercise. You don't need anything that's too heavy. As I said, a female could use a purse, or a male could use somebody else's purse or whatever. You can hold on to whatever weight you can grasp onto. It could be a jug of milk from the refrigerator, orange juice or whatever. And you walk and you increase your distance at your walk or your time. You can time it too. And boy, I tell you what, it increases your endurance, it increases your strength, and you get a great cardiovascular workout. And I love the farmer's carry. And that is my last slide. So does anybody want to see any of these slides again? If not, I'm going to do stop sharing this screen.
Joe, John has another question. He says, what are your thoughts on a standing desk? Yeah, what are your thoughts on a standing desk?
Okay, so I love the thought of it. So remember, sitting is the new smoking, right? That's what people are saying. Like we've gotten the message across incredibly since when was it, like 1972 or something like that, when the Surgeon General put that stuff on smoking, although I'm still shocked that I see kids that are like 15, 16 years old taking up smoking. But we've done a great job educating our population on, you know, what happens to you when you smoke, right? It's hard to smoke your whole life and make it past 75. It really is, with all the things that happen to our circulatory, everything. So sitting, they've kind of, you know, they've kind of done their campaign. They did an incredible job the past 40, 50 years, but now they're starting a campaign about sitting. And sitting is horrible for your musculoskeletal system, shortens your hip flexors. So the muscles right in front of your hips, it shortens your hip flexors. It typically, you know, when you look at a little toddler and they're playing with their toys, if you ever watch them drop a toy, and this is after they can stand. I don't even know if that's toddler. I'll say a little baby. I forget my milestones on when you're still a toddler. But when you know, like when you're 12 to 15 months and you start standing, walking, when they drop a toy and they bend over, they use perfect mechanics. Like they bend at their hips and knees, and they reach down and they bring it back to their body. And they're starting to think that we start to develop poor postural habits and poor biomechanical habits when we go to school and we sit all day. That's what they're starting to think. So if you don't have an ergonomically styled or made chair, it also creates all kinds of postural deficits that are going to occur more and more with life. So now if you have those tables that you stand, you get to, all your muscles can remain at an optimal length. You get the feeling that you're doing an activity. I love those desks. I think they're a great idea. And you know what? Instead of taking a break from sitting all day and then having to stretch, and the reality of it is time goes by fast. You don't do it as much as you're supposed to, like every 20 minutes. Who gets up and stretches and walks around every 20 minutes if they're doing some project sitting? So when you're standing, if you get tired, and which is possible because our postural muscles do get tired, we go and we take a break sitting. So it's the other way around. So I really like those. I like those desks.
Thank you.
Sure.
So yeah, oh, we have another question.
Okay, I'm gonna see.
Coming in.
Let's see if I can get this screen off of here.
I'll unmute Monica.
Yes.
Yeah, Monica, would you like to ask your question?
Oh, okay. Can you hear me?
Yes.
Yes.
How do you engage the elder client or patient to participate in physical activities in times like this? Because I have a very hard time to motivate the client, the elder client, and clients in general, for physical activity. But in these times of lockdown and isolation, how do you engage? What do you use? What is your technique of approaching them?
So what I like to do is I like to be an educator, and
Right.
I like to let the, if it's kind of how, you know, it goes back to the old saying that you could lead a horse to water, but you can't make him drink, kind of thing. Yeah, those who want to change a behavior have to be motivated to do it. I can't do anything, you know, to make somebody access activity. So I could be an educator and I could talk to them about all the effects of immobility and the benefits of activity and this,
Right.
and then I have to let them choose. I have to say to them, I have to turn it back to them. Do you want to increase your activity? Do you want to start doing some exercise? What is your goal? And you have to kind of like turn it back on them, because it's really, if you look at psychology and all these new programs that are coming out, it's really the only way of changing somebody's behavior is having them. And let's face it, most people know that they should be exercising more. Most people know that they should be physically active. So rather than telling them what to do, which, you know, it's just human nature that you don't really like being told what to do. So let them, instead of pulling it out of them, let them talk about it. That's why I usually tell them to write down 3 things. Say, well, what 3 things about exercise or what 3 things about physical activity do you want to improve? And then just go back to say, okay, out of those 3, which is the one that is most important to you? And then you just say to them, you know what, let's work on that one first. It doesn't go well with physical therapy because we're so used to telling people what to do. Physical therapy, you know, it's kind of like when you go into health coaching, it kind of, you know, we're really, you know, we're trained to tell people to exercise or to tell people to do a certain activity. And most people love physical therapists. You know, you build a professional relationship with them and you build a friendship, really. And a lot of times they'll listen, they'll shake their head, yes, and they'll listen. But will they go home and do it? That's a different story, right? There are some people that are uber motivated to be the best at everything. And those are the easiest patients. But what about the ones that go home and come back and tell you, they might tell you they did it, or some of them are honest and like, nah, I didn't feel like doing it. So that you have to kind of pull it out of them. Say, what is it? What can we do? You know?
Yeah, right. Thank you.
Sure, thank you.
And there seem to be no more questions at the moment. last call, anyone? Comments? Thank you for joining us, Lisa.
Yes, thank you, everybody. This was cool. I like it. Maybe we'll start doing all of our presentations by Zoom now.
Well, that was awesome. Really, really good.
Like in front of people because it's easier to ask a question. It's easier to see what's going on and everything. But this was good.
Great, thank you.
Yeah,
Right,
really
I
great.
unmuted
Thanks,
everyone
Jill.
so they could.
Thanks, Emily.
From the comfort of the kitchen, yeah, it's good.
Thank you, Jill.
Oh, you're welcome.
Thank you.
Thank you.
That was very good.
Thank you, Joe, and nice meeting you.
Thank you. Nice meeting you.
Thank you for the information. Thank
You're-
you.
You're very welcome. Thank you.
So, well, thank you for joining us. If anyone has any follow-up questions or would like any information, please feel welcome to email me or your care coordinator that you have a relationship with. I put my information in the chat and I will place it one last time. Allegiance is a 5-star Medicare rated home health agency, and we provide private caregivers, physical, occupational, and speech therapists in the comfort of your home. And we have people available immediately. So please feel welcome to reach out to us if you have any questions or need help during this time. Thank you. It looks like everyone. Did we lose Joe? Yes. Okay. Well, thank you. Have a great rest of your day and stay safe, everyone.
Thank you.
How do you do?
Okay.
All right.
I'm going to end it. Bye.
Okay.